Hello and welcome to I'm Every Woman TV. It's our first anniversary today and we're so glad that you're here with us. It's great to have loyal viewers and it's great to grow to 1 year. It's been a great year. Today we have a really special show lined up for you today, and we're featuring our first guest is Dr. Daniele Rad, who is both an MD and a doctor of naturopathic medicine. He's here to talk about a very important topic, women's health. Often, ladies, we put ourselves last and it's to our detriment. So today we're going to talk a little bit about women's most common chronic diseases, the complications and the solutions. So you not only know the warning signs, but you are prepared. And then we're going to have David Cohen coming in. David Cohen is the host of Small Business Big Ideas, a radio show. He is a business coach and he's also a new author of the book, Bust Out, Ignite Your Inner Entrepreneur. He's going to be talking a lot about baby boomers in business and growth strategies for baby boomers in business. And statistics show that most baby boomers in business are women and growing every day. So please stay with us. We're going to have a great show and we're going to get going right now with Dr. Daniele Rad. Welcome, Dr. Rad.
Hi, Janet. How are you doing?
I'm great today. How are you, Dr. Rad?
I'm great. Thank you.
So we're talking about a very important topic, women's health, chronic diseases. Tell me a little bit more about yourself, and then we'll get into the questioning. So I mentioned that you are a medical doctor.
Yeah, I'm MD. I'm graduating from medical school in Italy. I'm MD and general surgeon. But I'm involved in natural medicine by any means, all type of, let's say, technique that I learned in natural medicine. Mostly I emphasize my practice in energy medicine, actually. So there are almost 35 postgraduate I have. I don't remember all, it's not sure to say. But people, they can go in my website and see my medical credentials. It's a long list. But anyway, the most chronic disease of women, from my understanding for last almost 30-40 years of medical activity, medical field, is what I see: depression, anxiety, negative thoughts and beliefs, worries, too much fear of known or unknown stuff. And what I see, different age of women, there are different disease may come up. We know that osteoporosis, osteopenia, arthritis goes above 45, 50 and high. And in young age, I would say mostly I see a fibromyalgia, chronic fatigue syndrome, autoimmune system related disease, inflammatory disease. There are many, but what I see normally, women who is suffering from disturbed sleep, insomnia, and which ends with chronic pain here and there, muscle pain, joint pain. But Janet, when the pain stays there, or any illness, any symptom stays there and doesn't go away, by itself won't go away, and there is no any tool in medical field to eliminate it totally, it will take energy of the body. It will take energy of central nervous system. It will take energy of autonomic nervous system. Therefore, will disturb whole area, whole body. And normally, I don't see the body as a part of bodies, but I see that in whole. That means there is, let's say, heart is not far away from stomach, the stomach, and so on. Mostly hormones imbalances in women is a big problem. And I see 75% of women, they are taking some type of hormone supplements, different way. Still, they are having problem. Still, their problem is not gone.
So, Dr. Rad, why is it? I mean, the statistics show that women are higher risk for these type of chronic illnesses, including heart failure and what have you. Why is it that women suffer more than men from these type of things? Why are we more subject to having chronic illness?
There is a specialty, or woman is a specific individual. Woman is creature that is really specific. When I use some word, don't panic when you hear this word. I say, woman is not human being, but woman is angel. Okay.
Oh, Angel, that's nice.
Yeah, really they do. And what they do, they put tons of too much energy. They give service, do, think, worry about children, worry about husband, worry about their life, personal, financial, political, whatever you name. They put too much. I mean, that much they give, they don't receive that much.
Right, we
This is
tend
the
to
main
put
problem.
ourselves last.
Yeah, that is wrong. That is totally wrong.
I know, we put the wife role, the mother role, the daughter role when we have elderly parents to take care of.
Yeah.
Even the friends role sometimes before our own
but
needs.
giving too much, receiving not that much causes problem. And we know that we are a unit of vibration, and our body physically is moving because of that vital energy or prana. If there is any disturbance, blockage of energy in system, so therefore any disease may come up.
So you mentioned this block, and it is a repetitive thing, right? Can be ongoing for years, therefore leading up and building up to perhaps not just heart disease, but stroke, also cancer.
Many things may come up when there is a blockage of energy. Energy, what does mean energy?
Yes.
Energy is the power that we don't see, but we can feel it, we can sense it, but we don't see energy. And this energy called vital energy in human being, that is vibration of electrons, vibration of molecules, and whatever they are moving. And normally they are disturbed by negative emotions. Okay, if somebody feels sad, for sure hormones, they are disturbed different way. Heart rate goes up and down. Let's say blood circulation changes, stomach feels the same. Somebody is afraid, kidney starts to work faster, urinary bladder cannot hold it. So anyway, each organ, each system is affected by each specific negative emotions, negative thoughts, negative beliefs, and from combination of them. So when combination of them involved in such a case, that's why patient goes through chronic disease. If any symptom or disease lasts more than 6 weeks, is called chronic. When it becomes chronic and get worse, then they call that syndrome. When they say syndrome, is really a tricky word. When they say syndrome, that means indirectly, honey, there is no cure for you, unfortunately. But
this
in
is
natural,
a common thing in traditional medicine. There is no cure, they say.
But in natural medicine, we have different way, different strategies, different techniques, different art in medical field we can use.
So what are some of those techniques in your way of doing things?
Energy medicine. Energy medicine through energy is a very vast, huge field. I cannot talk in a few minutes, but through this energy medicine, we can do all. There is nothing they can resist.
Why don't you define energy medicine and also chronic illness? Because I don't think our audience maybe understands the difference between what you define as a chronic illness and what you define as energy medicine.
Okay. Now, when we talk about chronic disease, that is the disease which is lasting longer than more than 6 weeks, and we see that lasts for years and years. So let's say fibromyalgia lasts forever. Depression lasts forever. Not 2-3% of people by chance they find their way, their unconscious mind helps them to get rid of that. Anything stays in body more than 6 weeks is called chronic disease. When it's chronic disease, everywhere in body is involved, gets involved. And complication of such a symptom that you mentioned in the beginning is going through different disease. Somebody may have constipation, after a while gets hemorrhoid, and then gets diverticulitis, and then gets colon cancer. So this is
so these are some of like the warning signs in the way that they would appear.
That's right.
Over a long time.
There is no any chronic disease may not get worse and may not get involved with the other different, may not cause other different disease to come up.
Now, have you noticed an increase in like chronic fatigue syndrome, fibromyalgia, autoimmune deficiency? Are they on the increase in the last, let's say, decade? Yeah. And what would you attribute that to? Lifestyle?
Depends on many factors. One of them is If one little symptom, very mild symptom, lasts more than 6 weeks, will disturb everywhere. I mean everywhere, will disturb glands, will disturb hormones, will disturb digestive enzymes, and consequently, as a complication again, will disturb each organ one by one, and all each system one by one. So therefore, this body, hardly I can say, can get rid of all these problems through allopathic medicine. So it becomes so complicated, becomes so confused that they cannot do nothing. Because in allopathic medicine we say, okay, headache, this is painkiller, this is constipation, this is laxative,
right, Band-Aid.
this is just remediate temporarily. But in natural medicine, normally we go to the foundation of the problem, find main reasons, normally is not 1, 2, 3, and eliminate them from there, and build up immune system from the foundation, come up to healthy condition.
So in order to be able to do that, you have to really analyze a patient and patient's medical history.
Yes.
And you have a particular methodology for that?
Yes, my approach towards most of my patients, they are chronic disease. They are coming with chronic disease that they didn't get any help in allopathic medicine. So my strategy, my thing is, the policy is this. I sit down, even it takes hours and hours, I don't care. So I go through past emotional and past medical history of the patient and get them step by step in detail, and let the patient go, read, study, and come up to see why, what happened, what emotion. I realized that in my practice, there is no any sickness, illness, disease which is not started with negative emotional issues, which is not started from fear and worries.
And also, do you look at things as the type of medications they're taking and how they're interacting together to cause these type of problems?
For sure it does. When we talk about pharmacy or pharmaco or medicine, in Greek, pharmakia means poison.
Oh, really?
Toxin, poison, toxin. Read the dictionaries. And when we say that pharmacology, that means poisonology. That means studying the poison, how poisonous they are, what they can do. But anyway, chemicals normally, they make something good, but meantime, they do something bad. So this is called side effect of medicine. And for sure, they cause problems.
Now, when someone comes to you, I know you just said a minute ago that they may have tried the traditional medical route first. They're not getting any answers. Maybe they're being pushed around from one doctor to a specialist, being given a lot of tests, perhaps even a lot of Band-Aid meds that aren't working for them. Does that not just contribute to the emotional state that they're already in? Since you've mentioned that the emotional state is a big culprit behind it, when they're not getting the help that they need and they suffer continuously, does not contribute to the emotional state.
In allopathic medicine, when patient goes to doctor, for sure start with family doctor, his job is asking what is wrong, here pain, here their problem, what is that? This is the medication, take it. I don't blame on medical field, I don't blame on doctors, specialists. I blame in medical science. Is not that good, that sophisticated, can help. And maybe I have seen some family doctors say, okay, maybe you are nervous, that's okay, take it easy. But just telling take it easy is not enough, because emotional wound this woman have gone through for some reason. There are many reasons, many type of negative emotional issues or emotional ones. They must be deleted from their database. Otherwise, we'll keep running the situation, we'll keep running the life of this woman, and make her to be really, I'm sorry this word, have really non-pleasant, non-happy life.
Wow, well, we don't want that.
Yeah.
So, we're going to take a quick little break, and when we come back, we're going to talk a little bit more about the solutions to these chronic problems. Welcome back to I'm Every Woman TV for our first year anniversary. Before the break, we were talking with Dr. Daniele Rad about women's health. We're talking about women's chronic illnesses, the complications and the solutions, and we're going to get to some of the solutions right now. So, Dr. Rad, before the break, you were very good at explaining sort of what causes or the warning signs that a woman should look for when she feels that she's going to be suffering or has the oncoming of a chronic problem that could lead to the breakdown of any major organ. You mentioned hormones was a big part of it, hormonal imbalances. What is the best way to determine if a woman is having some sort of hormone imbalance? Is it strictly by a blood test, or is there other methods?
No, there are many things may show. One of them is their health condition. If we see the first sign for me when I see the woman is sad, down, introverted, depressed, kind of mild to severe depression, and then the first thing I ask about the age, hormones, and mostly about thyroid gland. Normally, hypothyroidism is one of those diseases that causes depression. So in this case, needs to get some hormone supplement. I mean, thyroid hormone supplement. And then we see from different signs and different symptoms what is going on. Is that related to hormones or not? We know that hormones, they are catalyzers. In other words, if there is no hormone, no function will take place in our body. Physiology will be pathology. So anything happens, for sure hormone is involved. And meantime, through blood tests, we can find that what hormone is lacking, what hormone has problem.
What about saliva tests? Are they accurate?
Saliva test is a kind of traditional. I would say, yeah, must be accurate, yeah.
And is there anything else like warning signs in the eyes or yellowing of the skin that jaundice?
For sure, that clinical inspection normally shows that what is going on. If I see patient comes in with yellow sclera or then I right away direct my diagnosis toward liver and so on. Yeah, complexion of, we call that clinical inspection or diagnosis helps us so much to just start and direct our diagnosis.
Liver is a big part of what goes on. I know if you have a fatty liver or something like that, it will cause problems. It will even prevent you from losing weight. And yet today, because we're bombarded with messages from television, from print ads, what have you, about eating healthy and taking vitamin supplements, a lot of women do choose to take cleanses that are supposed to break down the liver content and help. What's your take on that? Do you think that that's a positive thing or not such a positive thing?
It's a kind of helping situation. From my understanding, eating healthy is good, but not necessarily is necessary. Mind must be healthy. When mind has problem, mind is a software of hardware, which is our body system. So if mind has problem, if you eat the best, healthiest luxury food, when you are angry, I swear to God, you cannot digest nothing. When you are worried about something, when you are afraid of something, when you are planning, I say patients, when you eat, no phone call, no TV, no newspaper, no argument, no talk about business and nothing. Just concentrate and socialize with your food. Say that how beautiful you are, how nice you are. I will digest you and enjoy and grow up. So mind is important for me from my point of view, rather than having healthy food and having tons of those supplements in health stores. They are useless if digestive system is not doing well. And digestive system will not doing well when mind has filled up with negative emotional issues.
Well, we talked a lot about the complications, so let's get a little bit into the solutions of how you treat these chronic problems. So again, you said diet wasn't going to do it alone, neither were supplements. Would exercise help to correct a mind that's in a negative state?
Yeah, we have different stages here. The way you are talking about supplements and eating healthy and exercising, this is our duty. We have must to do, especially women must do, because normally they overload themselves and they get exhausted. That's why they get more sick than men. And as a maintenance, they have to dedicate specific hours in their life to themselves, to do meditation in order to clean up their mind out of those, let's say, non-healthy thoughts and beliefs, and do physical exercise in order to, let's say, make their physical be more healthy, be active, and take care of their food, have healthy and good enough supplements to forward to system whatever they need. But again, most of disease, they come from two ways: digestive system problem caused by mind problem. Negative emotions, negative thoughts, emotional wounds, they are the main reason of any disease.
So now, how do you specifically and uniquely in your practice target this emotional mind problems? What specifically do you do for your patients to help them overcome the mindset issue, and then that can lead to their health improving?
In such a, let's say, a field, I use energy medicine again. There is a technique which is called negative emotional release treatment. Has nothing to do with psychology and psychiatry, whatever. It's a straightforward technique that allows me to help the patient to have access to her own database and dive in her own mind, let's say, ocean, and find out what are wrong there, and pick them one by one based on their severity and seriousity, and then I help them to delete them. So this technique we cannot talk about here because it's too long, but this specific technique may and will make negative emotion be gone in a second. The same way you have access to your database in your computer, and the program you don't need it deleted is gone. It will not come back.
Is it that easy? Like, how long realistically does it take to replace a negative thought with a positive one?
Okay, normally we don't replace negative with positive. When negative out, positive will go automatically in there. And it takes time, depends on how many issues the woman has and how severe they are, how chronic they are, what complications they have, what consequences they created. So each case is totally different. We cannot say that the problem with Miss A is equal the same Miss B. These so many hours must be there. Each case is different. We human beings, we are unique. We are the same, and nothing looks like each other problems. So I don't know, depends on many factors.
So walk me through, because I know today you also have a giveaway for an analysis of this sort. You call it a complimentary consultation, and it's worth $120 plus tax to the first viewer who emails in to claim the prize. And the email address they need to use is Janette, JANETTE, @yourmarketingmagnet.com. Now, the person who is lucky to receive this, win this, the bearer, can you give me a little walkthrough of what they should expect with this consultation?
We will contact from our office, and normally I do first consultation examination is the first session. I do that between 12 to 2 because I want to be one by one with patient, not be distracted with other patients. 45 minutes to 1 hour average. I need so much time to analyze past medical history, past emotional history of the patient. So these two factors, they will lead me, they guide me to find the main reasons of the problems. And I let the patient ask any question they have. In case if it takes longer and we didn't finish the story of past medical, past emotional history, we book another hour, so we'll come back later on the same week or following week. Until I'm happy, satisfied with all information I needed, then that's the time I give plan and protocol, whatever must be done to this patient, I put on the table and advise her to start.
Okay, so you prescribe sort of a regime for them that I guess if they follow properly over a certain course of time can lead to significantly improved results. You mentioned energy healing a lot, and just as we're closing out a little bit towards your end of your segment here, can you define specifically energy healing, what what do you mean by that exactly? What is energy healing?
Okay, your question is really interesting and is not that easy to answer your question in 2 minutes.
Well, just give me a short
because it's
version.
very huge. We have people, they have to know more about energy, they have to know more about superconscious mind, quantum physics, quantum intelligence, whatever you name it, which is that we are made out of, and which that they keep us alive, they guide us to do whatever we have to do. In other words, human being uses energy unit in his system, which is called mind, which is called unconscious mind. That's what woman has more than man, because they have no 5 senses, but they have 6 senses. Anyway, using this
that's right.
energy,
We have the extra sense.
yeah, having this energy guiding, directing to the body, that infinite intelligence knows where to go, what to do, when to do, how to do, all will take care of that. But this is the technique that a practitioner must be good at it, really.
Okay, well, I trust you're pretty good at it. So we're just out of time for today, but I wanted to make mention of the fact that you are here as part 1 of a part 3 series that we're doing on women's health, because I am a big believer in women's health. I think that, as we said earlier in the segment, women tend to put themselves last. They tend to put everybody's needs ahead of their own, and it's very important that we take control, ladies, get our health in order, get our mind in order. I really believe that when you are productive physically and personally, it will also spill into other areas of your life, like your professional life. So it's really, really important. I'm very glad to have you with us.
Thank you.
And thank you for part 1. When you return on December 17th for our holiday show, we will continue this conversation on women's health, and we'll focus more on stress. So look forward to that, ladies. And then I want to also just re-announce that there is the giveaway today that you've very generously given, a 1-hour complimentary review of your entire health situation with prognosis and diagnosis and suggested prognosis, worth $120 plus tax. Please email in Janette, JANETTE, at yourmarketingmagnet.com to claim that prize. It's going to the first one we'll receive. And I want to also mention your website again for further information on Dr. Rad. It is www.curesallergy.com. curesallergy.com. Okay, thank you very much.
Thank you, Janet.
And we'll be right back with David Cohen, who is going to talk to us about business growth strategies and his new book, Bust Out, Ignite Your Inner Entrepreneur. Stay with us.